My name is Manette, and I'm going to be doing a focused abdominal assessment. This is my volunteer, and we will begin by her reading the Indiana Wesleyan Statement for Consent.
I understand and consent that the following information will be gathered and isolated for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessments to be videotaped and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the students, are not considered liable.
Okay, we're going to begin our abdominal assessment. I'm first going to begin by using hand sanitizer to cleanse my hands before I start with the patient. And first I'm going to just do a generalized head to toe assessment. I'm going to be checking the patient's head, her hair, feeling behind her neck, around to the front for any lymph nodes, any tumors or lesions. Check for asymmetrical in her ear and her nose. I would take a pen light and have her follow the pen light. And I would as well check for pupil reaction with the pen light. I also would take that same pen light and look in the nose, make sure there's no lesions. I'd have her open her mouth, and I would look around again for any type of lesions with the tongue blade. Stick your tongue out, check the tonsil fossa, uvula, and then I just come down. I'd have her squeeze my hands as tight as you can for strength, and then I would check her nails and her nail beds for any drying, cracking, the shape of her fingernails, skin turgor. Alrighty, so she's fine with that. I would also check for flexion of her feet, push down, pull forward. Okay. Alrighty, so for our abdominal assessment, I'm going to begin by inspection. I'm going to just take a look at her abdomen, and it looks symmetrical. And then I'm going to auscultate all four quadrants using the bell as well as the diaphragm. And I'm listening for bowel sounds, active bowel sounds. And next I'm going to listen for her aorta. I'll use the bell for that. Okay. Okay. Next I'm going to do a palpation just a light palpation, so I want to let the patient know that my hands they're warm, but they could be cold, and to get all her tickles out before I start. And what I'm feeling for is her abdomen soft and tender, not any kind of lesions or possible bowel obstructions. And she's tending to want to push her muscles. I just need you to relax. And then I'm going to do deep palpation. Now, if the patient is having pain, you may not be able to do the deep palpation. I'm going to feel for her liver border to see if it's enlarged. And I want to do the hook procedure where you go under the liver. And then I'll come over here and feel for the gallbladder. And they both seem to be fine. And then I'm going to, there's a couple of other tests that I will do. One is the rebound test for patients sometimes that have appendicitis. If you press down over that area, a lot of times it doesn't hurt really bad, but then when you release it, they will feel pain upon release. Another test is the, you can push also on the left side, and if you push down and you release, then they would have pain. That's another possible sign of appendicitis. You also want to feel the femorals for lymph nodes, pain, keeping the patient's privacy. I'm going to have her, here, lift your leg out. Okay. I'm going to have you bend your leg. Now push, put your leg up and push against my hand. You push this way. Okay. And if she has pain doing that, then that's also a sign of possible appendicitis. There are multiple types of diverticulitis, Crohn's disease, appendicitis, peritonitis, so it's sometimes difficult to make a diagnostic alone upon exam. Let's see, there's another obturator and percuss the tympanic side, so you want to take the obturator side. We're going to, this time, I want you to push down. Push down. Okay. And if she has pain on pushing on either leg, then that's indicative of some type of bowel, possibly appendicitis. We also want to check for ascites. And to do that, you shake the belly, and if it continues to shake with like a slushing, like water, then you know that there's appendicitis there. You will also see a doming of the abdomen. The patient can also turn to one side, and if you put your hand under here, under the abdomen, and just shake it, you can see that the water, and you can see a shift from whichever side, from the left or right, depending on the side they're laying on. You'll see a shift. This side will be flat and this side will bloom out. Alrighty. So that's my assessment. I hope you enjoyed it, and thank you very much.